Hi friends, I am Dr. Pratap Sinator. I have done MD in Pharmacy Medicine. In today's video, we will start with corrosive poisons and poisoning from the corrosives. Corrosive poisons are poisons which fixes, destroys, erodes the surface which comes in contact. So any corrosive poison when it comes in contact with the body, it fixes on the body, destroys the body or erodes the body. They act by extracting water from the tissues and coagulate cellular proteins and convert hemoglobin into hematine. This is the basic mechanism by which the corrosives act. Coming to classification of acids, corrosives. Corrosives can be divided into strong acids and strong alkalis. Among strong acids includes inorganic acids or mineral acids which do not contain carbon compound like sulphuric acid, nitric acid, hydrochloric acid, etc. Organic acid includes which has like a carbon compound like carbolic acid, oxalic acid, salicylic acid. These acids are very weaker, but usually they get absorbed and has systemic effects compared to local effects. Both the effects are present, but comparatively compared to inorganic acid, their action is weaker. Coming to strong alkalis, they include anhydrous ammonia, sodium hydroxide, potassium hydroxide, ammonium carbonate, potassium carbonate, or sodium carbonate. So these are the few strong alkalis. In this video, we'll discuss about sulfuric acid, which comes under as mineral acid or inorganic acid. So mineral acids usually give an exothermic reaction when comes in contact with the skin, with the moist skin. They cause exothermic reaction when strong mineral acid comes in contact with the moist skin. The heat together with corrosion causes coagulation necrosis of the tissue. This produces a crust which prevents further penetration of acid into the deeper layers. So whenever acid comes in contact with the skin, it causes exothermic reaction and it erodes the tissue and forms a thin crust which prevents further absorption. But when the contact is long enough, it may also get deeper into the tissue and may be absorbed, resulting in a systemic acidosis, hemolysis, and decreased cardiac output. Damage is primarily superficial, which may result in sloughing of the extensive areas of the lining of the stomach and perforation if the corrosive is consumed, which results in mediastinitis, sepsis, shock, and death. So corrosives, if the person consumes, it not only erodes the mouth, skin, esophagus, it may also start extensively eroding, sloughing of the lining of the stomach and cause perforation, leading to again, which may spread to causing mediastinitis, sepsis, shock, and the person dies. They act as irritants when slightly diluted, but as stimulants when well diluted. So, if concentration becomes less, the irritant effect is decreases, but it becomes a stimulant, act as stimulants when it is well diluted. No trace of acid may be found if the victim survives for more than 2 days. After more than 2 days, usually the acids gets degraded or decomposed and it will not be found in the body. Common example in mineral acid includes the first is sulphuric acid, which is the commonest acid, which is strongest acid in the group of mineral acids. So pure sulphuric acid, which is also known as oil of vitriol, chemical composition is H2SO4, is a heavy, odorless, colorless, non-fuming, hygroscopic, oily liquid and has tendency to carbonize organic substance. So it is a heavy substance, odorless, colorless, non-fuming, hygroscopy that it tries to absorb the water, oily liquid, and has very tendency to carbonize organic substances. It causes superficial burns after only 1 second of contact and full thickness burns within 30 seconds. So within 30 seconds, it can erode the surface of the skin. Coming to signs and symptoms of corrosive sulfuric acid poisoning, the lips, if the person is consumed, usually becomes swollen and excoriation and becomes brown or black streaks may be formed. So if the person has consumed, then around the lips there will be brown and black streaks will be formed because of erosion. Person may not be able to consume all the acid and some part may be erode the sides of the lips. It may extend from the angles of the mouth to the sides of the chin and sometimes to the front of the neck due to flow of the acid. As I mentioned, because the person may not be able to completely consume the acid, it may flow from the side and may also present in the nose, neck. There is cause of mucous membrane of the mouth, throat, and esophagus. There is immediate burning pain, stridor, the person is not able to breathe properly, drooling of the acid, and odonophagia, person is not able to talk or smell, or there is a person not able to eat, drink, or eat also. Then there is epigastric pain, which spoon spreads all over the abdomen and thorax. There may be pharyngeal pain in the which is the commonest presenting symptom. Then there is lactations, nausea, and vomiting may also occur. Next, the person may, after has a acid erodes the esophagus, the person may try to vomit, which is a brown to black in color, may be quite strongly acidic, and may contain shreds of charred wall of the stomach. So, as after consuming water, person may try to vomit, which is brown to black in color, and it may consist some charred wall of the stomach. Thirst is intense. Since the sulfuric acid is hygroscopic, it tries to absorb the water from the tissues, but any attempt to drink causes severe vomiting since it prevents the water absorption. Circulatory collapse may occur immediately after death and may result from asphyxia due to edema of the glotis. Circulatory failure and asphyxia is the commonest cause, but the person may die because of that. Teeth are chalky white since they react with the teeth and cause chalky white in color. Tongues become swollen, sodden, and blackish. The abdomen becomes distant and very tender to touch. Constipation is severe and there is tenesmus, there is severe pain during passage of stools. The voice becomes hoarse and husky if the person survives for longer duration. The eyes are sunken and pupils will be dilated. The mind will be clear till the person dies. The person, if they recovers, has late esophageal and gastric and pyloric strictures, and stenosis may also develop. Since it erodes the skin, it may cause second to third degree of burns. The healing may occur has in form of scar tissue, there is stricture formation, and also stenosis may develop. Permanent scars may also appear in the skin and oropharynx. Fatal dose of corrosive is 10 to 15 ml. So 10 to 15 ml of consumption of corrosive is fatal. The person may die because of that. Within fatal periods within 12 to 24 hours, the person may die because of corrosives, because of sulfuric acid. Cause of death because of sulfuric acid: one is circulatory failure, then spasm or edema of glottis, which lead to asphyxia, and because of that, person may die. Collapse to perforation of stomach, so stomach perforation lead to bleeding, hemorrhagic shock, and person die. Toxemia, mainly if there is erosion, there may lead to sepsis and lead to toxemia, and person may die. Delayed death occur due to hypostatic pneumonia, secondary infection, renal failure, starvation due to stricture of esophagus are the commonest cause of delayed death in case of sulfuric acid poisoning. Coming to complications, it can be acute and chronic. Acute mainly because of again corrosion, there is stricture formation, constriction, there may be airway obstruction and injury, GI hemorrhage may occur, esophageal and gastric perforation may occur, sepsis, then tracheobronchial necrosis, atelectasis, obstructive lung injuries are the common acute complications. Chronic is seen when the person is long-term affected with the poisoning. There is esophageal obstruction, pyloric stenosis, mainly because of scar formation. This complication occurs. Then vocal cord paralysis with airway obstruction may also occur. Treatment of sulfuric acid: we should avoid gastric lavage. It is one of the absolute contraindications for gastric corrosives. If the gastric lavage is done in this case, the acid may be regurgitated and may cause severe damage, more damage than it is intended. So similarly, amenities also should be avoided or should not be done at all. Next line of management is dilution of acid. The acid should be immediately diluted and neutralized in situ by giving 1/4 liter of water or milk of magnesia or lime water or soap suds or aluminum hydroxide gel. So these are the few items should be given to neutralize the acid within 30 minutes. If it is only effective within 30 minutes of ingestion. Alkaline carbonates and bicarbonate should not be given. So any alkalis like sodium carbonate, potassium carbonate or sodium bicarbonate should be not be given since it liberates carbon dioxide and they cause gastric tension, sometimes rupture. So this should be avoided. The acid should be neutralized by giving water. If nothing is present, water should be given. If milk is present, milk can be given, milk of magnesia can be given, or lime water should be given. But alkalis like carbonates should be avoided since it produces a lot of carbon dioxide, cause distension of stomach and rupture of stomach. Demulcents is also one of the option of giving which prevents absorption, like olive oil, milk or egg whites can be also given as form of demulcents. Next line of management is giving prednisolone. 6 mg per day should be given to divided doses to prevent esophageal strictures or for shock. Prednisolone is usually prevent to stricture formation. Shock is given. If strictures are present, usually about 4 centimeter, usually the stricture is slowly, gradually, the size of the stomach stricture is increased by using a rod which increases the diameter. Optic endoscopy is recommended to evaluate the extent of damage in esophagus as well as in the stomach. For burns, if there are second to third degree burns, an expert laparotomy should be performed to know the extent of damage it caused. If necrosis is present, esophagogastrectomy can be done in the esophagus, and if there is a damage in the necrosis in the trachea, tracheostomy is done to remove any necrosed tissue. This is to avoid the sepsis. To prevent a septic shock, the damaged necrosed tissue should be removed. Next, nothing should be given in the mouth. The person should not be fed. Only IV, the IV management should be done. IV saline, IV water, glucose should be given. Skin burns are washed with large amount of water and paste of magnesium oxide or sodium bicarbonate. So for skin burns, bicarbonate can be given since it can liberate carbon dioxide in the outside. So it can be given to dilute the acid, but it should not be given for the if the person has consumed the acid in the stomach. Eye burns are treated with water and sodium bicarbonate solution. Then later on symptomatic treatment is, and whatever symptom is present, symptom treatment is given. So this is the basic management of acid poisoning. First, any emetics or case lavage should be not be done. Gastric lavage or emetics should not be done. Then you have to dilute the acid by giving water or demulcents, or then prednisone to prevent stricture. Then nothing should be given mouth, skin and eye burns should be treated. Then symptomatic treatment is given. So this is the one line of management of sulfuric acid. Coming to postmortem appearance, if the person dies because of poisoning, because that is sulfuric acid poisoning, externally on the body, corrosion of mucous membranes of lips, mouth and throat, and of skin over chin, angle of mouth and hands are seen. Necrotic areas are first grayish white, but soon becomes brown or black or leathery in appearance. The clothing should be examined for presence of burns or stains. The presence of grayish white teeth is one of the things which in the teeth is seen in case of sulfuric acid. Internally, when the body is dissected, internal changes are limited to the upper GI digestive tract and respiratory system. So these are the way when has the acid enters the trachea and esophagus, they damage along the way, and the damage is seen as it passes the upper GI tract and trachea. Upper GI tract is inflamed and swollen by edema and severe intestinal hemorrhages, even when corrosion is absent. When acid is taken from spoon, lips, and mouth may escape injury, and it is seen in the mouth. In acid burns, squamous epithelium of the esophagus is usually relatively resistant and sufficient because the reaction is produced. Then there is perforation of esophagus is rare. The greater part of stomach may be converted into soft, spongy black mass which readily disintegrates when touched. Sometimes only pallor region is involved. So since the stomach, sometimes the because sometimes the esophagus may sometimes the acid may pass through the lesser curvature and enter the pylorus, and only the pylorus part may be damaged or eroded, and this is sometimes seen because as if the sulfuric acid travels along the lesser curvature of the to the pylorus. In the damaged area, the mucus or even the whole thickness of stomach wall has a brown or blackened color from acid hematine, and the wall is studded with acute erosions. Perforation may occur with escape of gastric contents into the peritoneal cavity, which may lead to peritonitis, chemical peritonitis, and corrosion of organs may be seen. Perforation of diaphragm may also occur if there are chances that it may come out of the stomach and it may perforate the diaphragm also. In many cases, little or no free acid can be found in the viscera. As I mentioned, it usually within 2 days it gets decomposed or it is degraded. Corrosion or severe inflammation of larynx and trachea may also be present. Secondary toxic swelling of liver and kidney is seen if the person survives longer. Linear tubules may show necrosis, primarily in proximal convoluted tumors may be seen if the person survives. Tests to determine what type of corrosive acid is person has consumed. For mineral acid alkalis, the only material suitable for analysis is found in the stomach. Stomach contents is preserved to analyze what was the poison. For sulfuric acid, if it is mixed with the barium chloride or nitrate, barium chloride or nitrate prochloride, it produces white precipitate of barium sulfate, which indicates that the person has consumed the sulfuric acid. Coming to circumstances or medical importance of sulfuric acid poisoning, most of the time it is accidental poisoning, result due to mistaking it for glycerin or castor oil or from inhalation of vapors in chemical factories. Most cases are suicidal. It is not used for homicide purpose because it is very acid taste. A person will not be able to consume almost immediately local reactions and the physical changes which produce in the food. It is taken internally or injected into vagina as a abortifacient can also be used. Most of the times, the sulfuric acid is used as a for vitriolage or vitriol flowing. That is, either vitriol flowing, vitriolage is done. So vitriolage by definition is throwing of sulfuric acid or another individual, which is known as vitriolage. So if acid is thrown on another person, it is called as vitriolage. Mainly it is done for as a way of jealous, discontented person may throw a corrosives to disfigure or harm their enemies. Usually commonly seen in lovers where they try to harm their girlfriends by throwing the acids. The burns are painless since it causes third-degree burns. They are penetrating burns and the acid devitalizes the tissue and predisposes to infection. Repair is slow and the scar tissue causes contractions. So it causes severe contractions and repair is very slow. Blindness may occur if it is eyes are involved. Death may result from shock or toxemia if extensive area is involved. So the necrotic area, if not properly removed, it may cause sepsis and possibly because of shock. Sometimes nitric acid, carbolic acid, corrosive alkali, or juice of macinate or clatter is also used to disfigure the face. Sometimes, other than oil of vitriol, other things can also be used for throwing to disfigure the face. Treatment: wash the affected part with plenty of water and soap or sodium potassium carbonate in case acid is suspected. Later, a thick paste of magnesium oxide or carbonate is applied to dilute the acid. The eyes, if it is involved, it washed with water irrigated with dilute sodium carbonate solution. Later, a few drops of olive oil, castor oil are instilled with the eyes. Molecular importance: under section 124 of 1 of BNS, causing permanent or partial damage by throwing or administering acid with intentional knowledge that is likely to cause injury, hurt, or permanent vegetative state will be punished with imprisonment of not less than 10 years or life imprisonment and fine. According to 124 BNS, if any person throws the acid and causes injury to the person, and he intentionally has done that, then he will punish for 10 years, which may extend to life imprisonment and fine. Section 124(2) of BNS, where it defines the attempt to throw acid or any corrosive substance with which is punished up to 5 to 7 years and also fine. These are my references. Thank you.